marijuana, cannabis, ganja. These are all terms used to describe the plant that contains the compounds cannabidiol and THC. Culturally, we are always changing our opinions on certain ideas, and cannabis is no exception. Just recently, the New Zealand government has been going through the process of changing its laws around the use of medicinal cannabis, and something even more controversial is their decision to hold a referendum to decriminalise cannabis in 2020. The poll was taken in January, asking the public whether they are in favour of legalising cannabis for personal use, and a surprising 60% supported this decision. This suggests that we may well be on the way to changing our drug laws by 2021. Because of this, I talked to Professor Michelle Glass, who is head of the Department of Pharmacology and Toxicology at the University of Otago and a researcher of cannabinoid receptors and their effect on the brain.
So, Michelle Glass, Professor in Pharmacology. I did my PhD a long time ago now. I completed it in 1995, and I was doing my PhD when the first of the cannabinoid receptors was discovered. So I actually mapped the cannabinoid receptor in the human brain as part of my PhD. So described where it is across the whole brain and looked at it and changes in diseases, and so that just sort of headed me off on a cannabinoid route, and I've been studying cannabinoids ever since.
You put out your review with the New Zealand Medical Journal, and would you be able to summarise what it was that you discussed in that review?
Yeah, sure. So essentially what we're saying is that just putting the word medicinal in front of cannabis doesn't make it a drug, doesn't make it a medicine. There is a definition of what a medicine is, and it's both a sort of pharmacological definition, but it's also a legal definition. You know, we have an agency, MedSafe, that assesses drugs and approves them for use in New Zealand on the basis of them meeting some criteria. And that criteria is essentially that you know what's in it, you know how stable it is and how it's going to react across time. So what's the shelf life of the product? You know, how long can you safely take it for and it still be active? How should you store it? Does it need to be in the fridge? Can it be on the shelf? That sort of. Does it work? Which most of us consider to be quite an important criteria. And who does it work for? Because nothing works for everybody. And so usually you've got some clinical data that would suggest where the drug might be more useful. Who should not take it? You know, what's it contraindicated? What other drugs should you definitely not take? What drug-drug interactions are you likely to see? Is it okay in pregnancy? Is it going to be different in the elderly? Can children have it? That sort of information would normally be in that sort of drug portfolio. And so I think what we're seeing here is somehow the desire to ask doctors to prescribe something that hasn't met that criteria, that doesn't have that data provided for it. And you can't just sort of say cannabis, because cannabis is a whole range of different products, and you know, one aspirin's not necessarily the same as another aspirin, and in the same way I can't say to you, oh, if you're suffering from this, go and take some cannabis, because you don't know what concentration of the different compounds you're going to be getting compared to what else is out there. So it's sort of not as simple as being able to say, well, maybe Sativex, which is a pharmaceutically produced medicine derived from the cannabis plant, that's been shown to be useful in a particular condition like spasticity, but you can't then generalize that to any cannabis-based product because that has a very specific composition.
What is the difference between, say, that product and its standards compared to standards of medicinal cannabis?
Well, so Sativex is pharmaceutical grade. So what you know, therefore, is that this batch is exactly the same as the batch you're going to get next month and the batch you're going to get after that. You know exactly what the THC concentration is. You know exactly what the CBD concentration is. You know how much you get in any single dose. So all that sort of thing is really tightly regulated. And that's part of the process of making something pharmaceutical grade, is that the production process is so tightly regulated and so standardized that you don't get variability. Whereas if you go and buy your cannabis on the street, You don't know the THC concentration or the CBD concentration. You don't know if it's pesticide free. You don't know if it's got mold in it. So we're not saying that there's no therapeutic value in cannabis. We're just saying that if you want to call it a medicine and ask doctors to prescribe it, then you should know what's in it and that it works and what the potential adverse effects are.
I think that's pretty reasonable.
I think so.
Yeah. Unfortunately, it's not quite as sexy as the idea of just throwing cannabis out there and going wild with it, but it is the wise way to go about it, I think.
And I think that's really different from the recreational debate, where there perhaps you want some regulation of the products to know that they're free of additives and that sort of thing, but you can leave it to the public to pick their favourite strain or, you know, whatever else. I think that's really different to prescribing something.
Do you think the legalisation of recreational or decriminalisation of recreational cannabis will help or hinder the process of creating standardization in medicinal cannabis?
I actually think it'll probably help. I think the two arguments are often subtly intermingling with each other. Sometimes not so subtly, but generally I think that it has the potential to actually take the pressure off the medicinal market and allow that route to be used for genuine medicines. Whereas now I think that somehow the access to potential medicinal products is in part being driven by people who are actually really have a recreational agenda. You know, if you say to someone, do you think cancer patients should have access to medicinal cannabis? You know, who's going to deny someone access to something if they think it's going to make them feel better? But what does that mean? Does that mean to a product that you know what's in it, that's been shown to be useful, that definitely doesn't have any mold? Because a lot of cancer patients are immune compromised and you wouldn't want that. Or, you know, I just think that it's easy to ask a question and it's easy to give a quick answer. But actually you need to define what you mean by medicinal cannabis before you can actually answer that question properly.
What do you think about private companies that are going out and just jumping on the hype and starting to produce their own products or sell their own products and say that they've got research behind them?
I think it's a dangerous space, actually, because no drug is harmless. You know, by definition, if you want to believe it works, you have to believe it can do harm. It's either inert, in which case it might not do any harm, but it also won't do any good. But it's sort of a basic premise of pharmacology that everything has the potential to do harm, and usually it's just about the dose. It's usually just about getting the dose in an area where you do more good than harm. I know some people feel that the pharmaceutical industry probably is making a lot of money out of this as well, but I guess my feeling is that the standards that we have around medicines are there to protect the public from people who are just trying to make money at the expense of proving that it can do good. In a doctor-patient relationship, you can have a conversation about, well, this could be worth trying and here's the potential harm, and you can make an informed decision, but you can't do that if you don't know what the product is.
So, it appears that regulations are being sped up because of pressure from the public. But why should the procedures that other drugs undergo be any different from cannabis-derived substances? Predicting the popularity and the demand of these seemingly natural products, many companies have started up in preparation of this sales boom. So, we've gone into a lot of that grey area. What are we more certain about when it comes to, say, CBD or THC within the realm of therapeutics? Like, what do we know they do?
THC definitely has some pain relieving qualities. It can stimulate appetite and it can decrease nausea and it can be useful for spasticity and the pain associated with spasticity as well. CBD is an interesting one because it's very it's very on trend at the moment, but actually a lot of the cannabis that people have been used recreationally has almost no CBD in it. As THC levels have increased, CBD levels have generally gone down. So we don't have a long history of people using CBD products except through sort of maybe some hemp oils and that sort of thing. CBD right now, we don't actually know what its key mechanism of action is. We know that it's not producing its effect through the cannabinoid receptors like THC does, but we don't know how it is producing its effects. There's a tendency right now, because it doesn't create euphoria, for it to be considered to be the safe cannabinoid. But I guess I feel like there isn't the data there yet. Like maybe it's coming through increased clinical trials, but I think the fact that it's not THC and it has a different side effect profile doesn't mean that it's necessarily safe.
How would we go about standardizing these products and making sure they're safe?
So I think in general, for that one, we need to do very little because those standards and regulations are already there. We just say make medicine and make it pharmaceutical grade. And we know that that can be done. Sativex has proven that it can be done in New Zealand, so you just have to kind of leave it be. And I know that's not the answer that anybody wants, but I think if it's going to be a medicine that's prescribed, that's what needs to happen. We've got the recreational referendum coming next year. I think kind of letting that play out as well, rather than rush legislation now that brings in something that is a less than optimal standard for a medicine. Have your recreational referendum, think about that and let the medicinal products develop on their own.
So I guess that plays into my last question, which is what should the public do coming up to this referendum?
Pressure. So I think the referendum, and we haven't really talked about recreational cannabis very much so far. To me, it's all going to come down to the wording of the question and what that's suggesting, because this could be anything from decriminalising through to creating a big industry like our wine industry, you know, with shops and retail outlets and advertising and all sorts of things. So I don't know what that's going to be, but in the medicinal space, I guess I know there's people who feel they're being denied access to something that might work for them at the moment, but I think that we are still best to maintain the standards there. And I think if it was my child, what would I want to be giving them? And I know I would want to be giving them something that I know is contaminant free, that I know is what it says it is, that I know works, that I know and can try and mitigate the adverse effects of. And so I think that's what we want to be aiming for, is maintaining standards of medicine.
Regardless of the possible therapeutic benefits that cannabis may have, we need to be more careful when making decisions about the future of this substance.